so
paper.
much.
So our
Next speaker is Dr. Mandar Jogodekar.
Good morning, everyone. I'll be fast in this presentation. In 2022, laser shows were used extensively in many cultural events, particularly in the Ganpati process in the 2022. This is a representative depiction of the laser shows where the laser beams were aimed directly at the crowds to increase their participation, and a sudden increase in premacular hemorrhage cases was seen in this period. A compilation of these cases is being presented with the aim to present the morphological features of these cases. It's a retrospective analysis, and all consecutive cases between May 22 and April 23 were included. The inclusion criteria is the history of laser exposure and the retinal injury examination. All the cases with unconfirmed or unreliable history of laser exposure were excluded. A demographic analysis was done. Image analysis of fundus photographs was done. Images were excluded if too blurry or details not clear. Treatment records were analyzed. Visual acuity and final outcomes are analyzed at 3 months interval. And statistical and correlation analysis was done. We included 51 patients of 51 eyes of 51 patients with overwhelming male dominance, 98% with average of 24 years. Eye laterality was equal, and no patient was wearing glasses at the time of exposure, but 11.7% had mild ametropia. This chart shows the level of involvement of the patients in the procession itself. 52% were non-participants, where they were not dancing or not moving along the procession. They were just watching the procession or just passing by the procession. 29.4% patient gave a history of laser light sweeping across the eyes, directly followed by the loss of vision. In image analysis, we found 42 photographs were available, 2 were excluded, 40 were analyzed. This chart shows the size of hemorrhage ranging most commonly from 0.5 to 2 to 3 diameters, with average of 1.29 millimeters and maximum of 5.4 diameters. Varied shapes of hemorrhages were seen, commonly pear, and most common location was central. This is a just an example of varied types of presentations we saw. The presence of white spot was noted in 33% of cases, presumably by the laser injury. The location of was subhaloid in 37%, sub-ILM in 42%, and in both layers in 20%. The OCT passing through that white spot showed a hyperreflection at the white spot, indicating a laser injury and hyperreflectivity of the hemorrhage. The FFA was done in one case, which showed the vascular staining, presumably because of the vascular damage. Hyalotomy, laser hyalotomy was preferred in 55% cases and 45% were observed. This is the final and presentation and final logmer visual acuity. With the final 42 patients obtained 6 to 6.9 patient vision, and only 2 patients had vision less than 636 at the 3 months. No correlation between presenting and final vision was found. Significant correlation was found between cultural events and incidence of cases. This is a time series analysis where we have plotted the incidence of laser exposure and the dates juxtaposed with the major cultural events. So we can see that in this graph that all the events coincide with the cultural events at the incidence. In complications, only 2 patients had poor vision, and epiretinal membrane and RPE mottling was seen in each cases. In conclusion, it's a predominantly male presentation. It's a varied presentation of premacular hemorrhage in both layers and varied shapes. It has usually good outcomes, but not without complication. It's a limitation is a shorter follow-up of 3 months. Maybe complications can arise later on. Strong history of laser exposure was associated, and temporal association of the retinal injury with the laser can be established with this history. We need to further carry studies regarding the exact possible mechanism of the injury. And as a no proper nomenclature is established, we refer this as a non-occupational laser exposure retinopathy. Thank you.
Now you said 50 out of 51 are males.
50, yes.
I mean, why is this?
Most probably because of the level of participation in this.
No, there were also bystanders, you said, people.
Yes,
so
yes.
maybe women avoid such, number one, or they were probably, smart enough to avoid that exposure when it comes across. But is there any kind of, I don't know, just Have you done any research? Like, is there any SOPs regarding the recreational use of laser in the from the government or something, or it is just that
In India, there is no, there are no guidelines.
it is
actually.
supposed to be in the air?
It is
should
supposed to be
it should
there,
not
not
supposed
to be. Even if you can project into crowds, but there are MEP levels are established, maximum exposure levels. It should not go beyond that MEP layers. But there is no one
Intensity
to,
and
there is no one to implement it on ground.
Any knowledge about the wavelength of those lasers?
These lasers are both visual range laser most of the times, not usually green lasers and the red lasers are used.
Did you try to elicit history as to repeated exposure? Was it a single sweep of the laser, or people gave a history of repeated exposure?
They didn't have that
Because
much
it's-
history, but because that
Laser has to be extremely strong, because if even a
Because
single
that's-
sweep,
Yes, because the
Single
30%
sweep can,
patient gave that
if it's
history
in
that
the right-
they saw the laser swiping across, and which was followed by directly bleed. or
So
loss
all of
vision.
them resolved.
All of them resolved,
Okay.
either with treatment or with a follow-up both.
So have you got any case with laser pointer? Because recently laser pointer cases are
Yes,
coming
I
up.
agree. I haven't included in that. This
Okay.
is specifically for laser
That is
shows.
occupational use.
This is
No,
This
this
is
is not
non-occupational.
occupational, but
children also
misuse, you can say.
misusing, and so many cases are recently coming up, and that's not treatable also. That's a issue.
any bilaterality,
no bilateral,
all unilateral.
all unilateral.
It's a very rare thing for it to really go through both the things.
It's where you are
Just a one
standing and
swab.
the,
Yeah.
if you're
just
perpendicular
sweep
to
and
the
cross.
sweep
Angles
one eye.
will be different on both eyes. Angle of incidence will
It's
be
the
different.
angle of incidence, so probably one eye will be more exposed depending on which side you are. Probably. Unless you're straight eyed, then you can have a bilateral.
Also, people who have peripheral, those white dots burn without a bleed, they may not come to you.
Yes.
So
obviously.
only
They would
which
have not
affected,
reported.
Only vision,
which
those
had
have vision affection. with,
and covering the posterior pole only had come to you
yes,
probably.
correct.
So Ganesh Visarjan was the most common one.
Most common is that, but other also processions are there.
A good observation. Thank you.